I am Dr. Abhijit Kirtane, and today we're gonna talk about multiple sclerosis, or MS for short. It may sound like a big scary word, but don't worry, we will make it simple for you to understand. So, what is MS? MS is a long-term illness where the body's immune system gets confused and starts attacking itself. Sounds strange and scary, right? Normally, our immune system protects us from germs, but in MS, it attacks something it is not supposed to. To be precise, it attacks the central nervous system, which, so to say, is your brain and spinal cord. These parts control everything our body does, from moving muscles to thinking, dreaming, feeling emotions, and things. And here's where it gets tricky. Our nerves are like electrical wires that are covered by a protective insulation called myelin. Think of it like a rubber coating over a phone charger. It helps signals or messages travel quickly between your brain and the rest of your body. In people with MS, the immune system attacks and damages this myelin. This messes up the signal transmission. It's like trying to text with no signal and the message doesn't get delivered properly. Because of this, people with MS might have trouble walking, seeing, or even thinking clearly. And here's something important. MS affects everyone differently. No two people have exactly the same symptoms. Some may feel very tired, while others might have muscle spasms, numbness, or blurry vision. Some might have memory problems or feel moody or sad. That's what makes MS so unpredictable. Doctors still don't know exactly what causes MS. It might be a mix of genes or the environment, like infections or low vitamin D. Interestingly, MS is more common in women than in men. So how do doctors figure out if someone has MS? They usually use MRI scans to look at the brain and the spine. Sometimes they do a spinal tap, which checks your spinal fluid, or test your nerves to check how they respond to signals. It can take a few different tests to be sure. There are 4 main types of MS: relapsing-remitting MS, secondary progressive MS, primary progressive MS, and progressive relapsing MS. Relapsing-remitting MS, that is RRMS, is the most common type. People have symptoms that get worse, which is called a flare-up, then feel better for a while, and this cycle repeats itself again and again and again. Secondary progressive MS, that is SPMS. After some time, some people with RRMS stop getting better and their symptoms slowly get worse. This is called SPMS, primary progressive MS or PPMS. In this type, symptoms slowly worsen over the years. Progressive relapsing MS or PRMS is the rarest type where symptoms get worse over time and have flare-up. Now, here's the big question. Can MS be cured? The answer to this right now is no. But there are treatments that can help slow down the progression. Medicines called the disease-modifying therapies or DMTs can slow down MS and reduce flare-ups. Newer therapies include steroids, next-generation monoclonal antibodies, interferons, immunomodulators, and stem cells. Physiotherapy helps with movement, and occupational therapy makes everyday tasks easier. And how can we forget the emotional side of things? Dealing with MS can be really tough for some individuals. Some people feel sad, angry, or frustrated, and that's totally normal. That's why support groups, therapy, and having a good team of doctors, friends, and family are so important. Healthy habits like getting regular exercise, eating well, sleeping enough, staying away from stress and smoking can make a big difference. People with MS often need to work with a team of specialists, neurologists for the brain and nerves, rehab therapists to help with movement, and counselors for mental support, to name a few. Living with MS isn't easy, but many people live full and happy lives. It takes patience, strength, and support, but it's not impossible. And here's some good news. Scientists across the world are working hard to find better treatments and maybe even a cure. They are exploring ways to repair myelin and figure out what causes MS in the first place. The more we understand about MS, the better we can support our people who have it. Talking about it, learning, and sharing what we know helps raise awareness and fight the stigma. We need to remember that MS doesn't define someone. It's just one part of their bigger story. With hope, care, and timely support, people with MS can absolutely thrive. So keep learning, keep supporting, and keep spreading kindness, because together we can make a huge difference. Thanks for watching. Dr. Abhijit Kirtane. Adios.